Okay, I think we're ready to start. Welcome to Engaging Parent and Family Partners in Transition Planning. Today we have Executive Director of FACT Oregon, Christy Reese, and Project Director of SPAN Advocacy Network, Don Monaco. The work of these organizations exemplifies the work of parent centers, leveraging collaborative interagency partnerships to empower families and improve transition outcomes. So let's welcome Christy and Don.
Thank you.
Thank you.
So I'll jump right in. Thank you, Brianna, and thank you, Intact, for having me. My name, as you said, is Dawn Monaco, and I am with SPAN Parent Advocacy Network. I'm a senior trainer there, as well as a project director for an RSA-funded transition grant. And most importantly, I'm a parent of an almost 24-year-old son on the autism spectrum. Next slide. Next slide, please. Okay, is it me or did it not move?
Has it moved?
Okay. Brianna?
No, it hasn't moved. So let's go ahead and switch gears and
There we go.
Okay, there we go. Thank you. So before we actually chat about what what we're doing under the parent centers that we're with, we just wanted to review the actual parent center network. So there are about 100 parent training and information centers, which we refer to as PTIs, and community resource centers, CPRCs, in the US and the territories. And there's one parent center in every state, and some states have more than that. So wanted to make sure you realize that there's at least one in every state. We work with families of infants, toddlers, children, and youth with disabilities from birth up to age 26. We help parents participate effectively in their children's education and development. And we also partner with professionals and policymakers to improve outcomes for all children with disabilities. Next slide. So we are organized throughout the country into 4 regions. You see here, we have region A, B, C, and D, and these are the states that are listed under each region. My center, SPAN Parent Advocacy Network, is in region A. And you can go to the next slide, and I'll pass it to my co-presenter, Christy Reese.
Thanks, Dawn. Hi, everyone. I'm Christy Reese. My pronouns are she, her, and I am the executive director at FACT Oregon. I am also the parent of a just turned 18-year-old. So transition in our home is front and center right now. And FACT Oregon is the parent training information for the state of Oregon through the U.S. Department of Education and through our Oregon Department of Education. And as you see, what our mission is, we want to empower families and youth experiencing disability in their pursuit of a whole life. And we want to expand awareness, grow community, equip families. And we provide a lot of different services to families and youth, our partners, educators, policymakers, and working in collaboration is a big part of what we do. And our vision really is to create communities that are accessible and empower self-determination for people with disabilities. Next slide, please. So we offer direct support to families, outreach trainings, technical assistance. We do parent leadership, advocacy, and we really want to ground families in the concepts of ableism, self-determination, high expectation, having vision for the future, and really ultimately disrupting ableism because we want to improve outcomes for youth. Next slide. So just a little glimpse of our demographics. We provide support in all 36 counties in Oregon, and our state has very rural areas and then very populated areas. We have struggled, like many, with trying to understand our demographics. We're we're getting better, we're getting more answers. So we have many that we aren't sure, but we do know that 65% identifies white or Caucasian, and 17% are Hispanic Latino, and Spanish is the second largest language spoken in Oregon. And you can see again that we have folks, we just don't get a lot of information, but we are starting to see in our state, we're adding Russian, Vietnamese, Somali, and Arabic to the number of languages that we are starting to find information and support. And we use language lines to support families. Next slide. So for transition, 30% of the calls we get are from families that have youth with disabilities that are 14 or over. And so we speak to just about every county. The counties that we haven't connected with are in very small, where there's not a lot of population. And people are asking about brokerage services, which is a service for developmental disabilities, where you get to choose whether you have case management with a county or a brokerage. People are asking a lot about diplomas, employment, guardianship, trying to understand what supported decision-making is, just the whole process of transition, vocational rehab, and what volunteer opportunities are available. So we spend a fair amount of time working with partners in this area. Next slide. So we know that we can't do it alone and we need partnerships. And so what I can share is that we really approach our transition trainings to be in partnership with other stakeholders. Next slide. When we talk about whole life at FACT Oregon, we're talking about individuals graduating from high school with a diploma, and Oregon has 3 different diploma options currently. We have a standard, a modified, and an extended diploma, which is typically for individuals who have had extended assessment since they were in elementary school, typically for those with more significant support needs. But we talk about getting a diploma, going for the most rigorous diploma. What are you going to do after high school? Are you going to work? Are you going to go to college? Where are you going to live? Who do you want to live with? Relationships. So not only just romantic or intimate, but also friends and your community. And so we do a lot of grounding families when we're growing is, where do we want our kids to be? Where do they want to be? And we talk about this a lot, and we take that whole life approach. Next slide. So I'm going to highlight one of our summits that we did this past January, because we took an approach that really wanted to look at whole life. We can do transition trainings. We can talk about the IEP in high school and when you're 18 through 21, and we can do that, but it's not the only piece we're talking about when we want to prepare youth to live their adult life. And so we took an approach that was much more whole life. What would include financial literacy? What are transition programs available across the state? What is supported decision-making? Oregon now has a rule that supported decision-making needs to be explained and presented at an IEP meeting so families understand what it is, trying to interrupt that school to guardianship pipeline. Also sexuality and relationships. What is that? And how does that look for young adults? And so we decided to pull this together, working with our partners. We had it in January. And if you go to the next slide, we had, so this was a virtual event in the beginning of January. We were still, Oregon was still very locked down, and in-person events were not happening. So across the state, we had 129 attendees, 107 were families with their youth, and we had some professionals too. And as you can see, we offered Spanish interpretation at all sessions, and then one was delivered just in Spanish. And we also provided ASL support for 4 sessions. So the individual had someone in the 4 sessions they chose. And we had 12 sessions over 4 hours with 28 speakers and panelists. So this is where we worked with the partners and stakeholders in our state to come and present information. So we had vocational rehab talking about those services, and our pre-ETS coordinators coming and talking about what that meant. We had developmental disability systems coming to talk about what that looks like and how it works with transition programs and vocational rehab. We spent a lot of time in supported decision-making. We had the Oregon Department of Ed come and talk about the diplomas and the work being done in our state about diplomas. Financial literacy, this was a new partnership, and we were really excited to introduce this idea of curriculum, and actually it was expanded afterwards, and I'll share a little bit about that. Sexual self-determination and supported decision-making, very popular session, and we had someone who is a professional in that field and who supports individuals with intellectual and developmental disabilities, who could come and talk to families and youth about what that means. We had resource families, our foster families, and so we had some talking to who are resource parents come and talk to families about you've been raising a child with disability, and maybe you might want to think about fostering a kid. The Oregon Able Savings Account, and that was the one session we delivered directly in Spanish to talk about what that option is and what it means for youth with disabilities as they move into adulthood. And then we talked about the medical setting, how we support an individual to make their own choices, and how they can use a one-page profile that talks about who they are and what works and doesn't work in that setting. Next slide. So what we heard from families was these things, and I highlighted a couple about pre-ETS because I think that was one of the big takeaways, but looking to pursue supported decision-making with DD services as opposed to guardianship, learning about dignity of risk or talking to your students. The diplomas, some folks weren't even aware of the options for diplomas and what that means in Oregon, and how agencies work together to provide information, and that the person is the decision maker. Next slide. When we asked how you would use this, you can see there were several who said pre-ETS, and I knew by that Monday, I think it was at least 3 new pre-ETS applications were received, and folks were saying, oh, I've learned that we need to have rigor and we should be looking at a diploma and not just a certificate of attendance. And so we felt really good about this. And you can see we had some very positive responses. Next slide. And what that did for us was also, we realized that we can do a virtual session and we can have a lot of different options and a lot of different trainings, and often we need to go a little deeper. And so what we planned was a financial literacy series, and we partnered with Oregon Able, so our Able Savings Account, and sorry, someone was saying goodbye, and our Division of Financial Regulation, and they worked together to create curriculum specifically for individuals with disabilities, youth with disabilities, and those with intellectual and developmental disabilities. And we announced it at the virtual session on the 29th, and we were starting in February, and we couldn't even advertise it. It filled up right when we finished that session, and we had 5 weeks. They were 90 minutes of going through financial literacy with families and youth. we set up community listening sessions. Oregon is looking at diploma options, what are available. And so we were able to bring families to come talk about that. And starting in May, I think on the 18th, we have a 2-part series about supported decision-making. So to really delve in a little more, what is it, is the first session, really diving in, understanding. And then the second session in June is going to be, how do you do it? What are the practical tips and tools? And so you can move to the next slide, please. And so these are the trainings that we either have on the books or we're repeating and working with others. And so we do all of this because we're looking to improve the outcomes, and it's so much more than just the IEP. And so we're delving in with our partners. And like I said, we do a lot of work with our Department of Education, but also with vocational rehabilitation and our DD system, developmental disability system. And so using those partnerships helps us bring robust information that is really applicable to youth with disabilities. And I think that's it. If you want to move to the next slide. And I don't know if we're just holding questions, Brianna, or for Dawn and I at the end.
So Christy, there was a question related to the demographics that you serve and whether or not you knew how that compared to the demographics nationwide.
I know for Oregon, I mean, our demographics look like what Oregon looks like as we keep trying to improve, but have not looked statewide. I mean, nationwide.
Oh, yeah. Or statewide. Yes. Jennifer clarified, or statewide. Awesome.
Yeah. Ours, if you compare, I mean, our demographics are changing in Oregon, which is why we're really working to capture in a way that helps us really understand, but it does reflect of what our population is.
Thank you.
Okay, so SPAN Parent Advocacy Network is New Jersey's federally funded parent training and information center. Our mission statement is, our mission is to empower and support families and inform and involve professionals interested in the healthy development and education of children and youth. So under this grant, these are the transition-related activities that we provide. So we provide monthly workshops, which include many topics, but under transition, we include transitioning from school to adult life, self-advocacy, and student-led IEP workshops. We also incorporate the supported decision-making within those self-advocacy and student-led workshops as well, utilizing that as an alternative to guardianship. We have transition mini conferences 3 times a year in both English and Spanish. We have workshops around healthcare transition. We have something that we call a youth chat. We started that during the quarantine when everyone was stuck at home, and we wanted, we actually started it as a family chat first, and then decided to have a youth chat. And it is a weekly, every Wednesday from 3:30 to 4, where young adults can get together, and we have a topic every week that we discuss, and it's run by our youth coordinator. I am on as a ally. I keep my camera off because they don't really want to see me. They want to see the youth. And it's wonderful. And we're finding that we're having not only more and more youth join, but a lot of the same join each week. So it's great. And then based on that youth chat, we have what we call our youth hub. So that's a blog, and it's based off the topic of the week from the youth chat. And we have a much more higher subscription rate on that youth hub, and that's emailed out every week. So that's been very successful. We also provide individual assistance to families and young adults through our Warm Line. We have a website a web page on our website called Youth in the Know, with many resources and articles. And then another thing that we did during the quarantine that we really were just kind of playing with was YouTube. Prior to the quarantine, we had a YouTube channel, but we honestly did not really do much with it. But we found that because this was the only way parents had of getting information, we really beefed up. We recorded everything we did, and we really started beefing up our YouTube channel. And we have many followers now, and it's wonderful. And I recommend that you check it out. But one of the we in the YouTube we have a playlist called Advocacy Stories for Youth by Youth. And then we also just have our general transition playlist. I didn't even know what a playlist was before the pandemic. So I've really, I've learned as well. Next slide, please. So that's our PTI grant. We also have, so as I mentioned earlier, we're in Region A, and we are also Region A's Technical Assistance Center. So we provide technical assistance to all of the parent centers in Region A, and there are 26 of them. So basically, we're the first place that the parent centers call when they have a question and they need help. So we help them to identify whatever needs they may have through an assessment process. We provide regular opportunities for networking with other parent centers, and we also provide information, education, and support to these parent centers to increase their capacity with their boards, their managers, and their staff. Next slide, please. So sticking with the region, we also are one of the RSA PTI centers. So the Rehabilitation Services Administration had provide grants to 2 centers in each region, and we have that particular grant. And so it is a region also technical assistance grant, and it's on transition. So it is jointly managed by us. We joined these centers in on this grant. So it's managed by us in New Jersey, the Federation for Children with Special Needs in Massachusetts, and the New York State Transition Partners that include NYC in Manhattan, the Parent Network of Western New York and Buffalo, and Starbridge in Rochester. So what we provide under this particular grant is information, training, and technical assistance and support to all 26 parent centers, as well as youth and young adults with disabilities and their families, and also professionals in Region A. And this is solely a transition grant. The goal of this grant is to improve transition outcomes for youth and young adults with disabilities in Region A. And this is the grant I am the project manager on. So I'm going to give you some more information on this grant. So next slide, please. So it's with the collaboration and partnership on this grant, as I mentioned, it's a Region A grant. What RSA did was split each region into 2 sections. And this is maybe a little bit more information than you really need, but Region A has Region A1, which is the northern part of the region, and Region A2. But we don't really work as 2 separate regions. We chose to work as one region. So we work together. And under this grant, we also give every center in our region funding to increase their transition work. So all the PTIs in our region get $10,000 a year, and all the CPRs in our region get $7,500 a year. And that is to really increase and enhance the transition work they are doing under their as their PTIs and CPRCs. And I do want to mention that in roughly 2014, the Office of Special Education Programs under the U.S. Department of Ed that funds these grants really charged us with working more with youth and young adults. So we are charged to do that. And this, the money that we're able to provide through this Real Transition Grant really helps them to beef up that work that they're already doing. So we as a team, we meet monthly to go over all the activities that we are working on. We work very closely with the region. The RPTAC is just our acronym for our region SPAN, which is our region Technical Assistance Center. And we work very closely with them and to focus on all the transition activities in each center. We have 2 conferences a year that we collaborate with them on. And we just had our conference in April in Puerto Rico, and we had, I believe it was 9 transition related workshop tracks in that conference. And then we meet again in the fall. We'll have something in the fall as well. Next slide, please. So this is just a list on how A1 and A2 are split up. But as I said, we work as one grant. Next slide, please. And then also what we do under this grant is we provide the technical assistance to all the centers on their transition related work. We also facilitate 4 annual webinars and also train the trainers. So we provide the centers with the presentation and the presentation notes so they can turnkey those webinars. This past year, we've been working with NTACT on the topic of vocational rehabilitation, and we're going to be facilitating our last webinar under that topic on May 17th. We're seeing a really high, just as Christy mentioned with VR, we're seeing a really high attendance rate at these workshops, because we're finding that a lot of families don't understand PREATs and how they access those services and don't understand VR. And so we're seeing like hundreds of attendees at these workshops, which is wonderful. But we're also going to be doing webinars around the topics of independent living, family engagement, and individual plans for employment, which fall underneath our VR topic. We have a resource repository on transition resources that we provide to all the centers. We continually add to it, and there's almost 400 resources in that now that they can access anytime. We translate everything we do is translated at least into Spanish. And then as I mentioned, we have the 2 convenings a year where we get together. Next slide, please. We also have, with our 4 convenings a year, virtual, they've been virtual. We hope to one day be in person, where the audience is parent center staff, adult system providers, parent leaders, and youth leaders. And we also have a newsletter that is developed by one of our partners and then sent out to every center in the region for them to edit to their own activity. So we provide the shell and they can add information to that and then send it out. So it's a transition-based newsletter. So that is sent out to everyone and it's released monthly. And we also started something that we call Transition Tuesday. So we have a running list of links and topics that we provide to our centers that they can just copy and paste and put it on all their social media. And we've also did some technical assistance with those centers to help them to possibly purchase some of those social media platforms such as Hootsuite, where you can go ahead and just schedule a lot of social media posts at one time. So we provide them with the post and all they have to do is put it up on their social media. Next slide, please. We also have, yes.
Can I stop you for a quick question before you get into the governance board? You have some questions about, you talked a little bit about offering your centers kind of frames for the newsletter, but you talked also about doing trainings and stuff around self-directed IEP or student-led IEP workshops and things like that. Do you also, as a kind of a TA provider, provide like draft agendas for those conferences, and maybe are y'all willing to share those types of curriculum for those folks? And if so, how would they access it?
So, if our one of the centers in our region wants to hold a conference, we will work with them to help them. We don't usually provide an agenda unless they need help putting the agenda together. We will help them with that. As far as sharing, I guess I'm not really, so curriculum for conferences, is that what they're asking
The
about?
curriculum for the student-led IEP workshop. So you're,
Oh, so
what are
we
you
actually, they can go right onto our YouTube channel and see those workshops.
okay.
They are recorded and on our YouTube channel, but I'm happy to share my email address and provide information on that if they'd like. So
Thank
I'll put that in the chat box at the end, if that's okay.
Perfect.
Okay.
Thank you.
And also this is the second iteration of this RSA grant. We had it also the first time around, but it was called something different because we did not, at the time, we're not partnering with other centers in our region, and that was called Reach for Transition. And in our YouTube channel, you'll see many, many, many recorded presentations under that grant. And we did a 4-part supported decision-making series. We did a 4-part sexuality and disability series, and they're all recorded and under in that YouTube channel. It's the transition playlist. And again, I'm happy to share my email. If you need help finding those, I can share the links. We also, under this grant, have a governance board. It's representative of the parent centers in our region. So for the first 2 years, we have 6 parent centers on it, and then we'll switch and add more the next 2 years. We have 3 adult advocacy organizations that we work with, ASAN, Youth Move, and YASA, and they are members of this governance board. And we meet twice a year, and basically we just inform them of what we are doing, ask them to make recommendations for topics of things they may be seeing in their communities. And we ask them to just review what we're doing and if they have anything that they'd like to advise us on. Next, please. And under youth, we just started with this in the last year. And again, it's been very successful. I see that we have one of our Youth Leadership Council members here attending this. Emily Balch is on, I see, and she's one of our Youth Leadership Council members. So we decided in order to really work more effectively with youth, we asked all 26 parent centers in our region to find a youth leader that they work with and ask them to be part of this council. So it did not have to be somebody who is actually hired by the center. It could be somebody that maybe they provide a stipend to occasionally, but somebody that they've worked with on a regular basis or they want to work with on a regular basis, and identify them. And so our youth coordinator, who I work with, holds these meetings quarterly. We get them all together virtually. We discuss what we're working on with youth. We ask them to update us on what they're working on. We ask for an update of what they're seeing in their communities. And based on what they're seeing and what they really need help with, like professional development on, we bring in also those same youth advocacy organizations to do presentations for them to help them. We actually have one next week where we ask Asan is presenting on mental health and helping them to work with youth in their communities around mental health. And then we also, it wasn't easy to get all 26 centers to identify a youth. So we helped them with that and provided technical assistance on helping them reach youth. And really, we know as parent centers, we're all 3/4 of us in each center are parents ourselves. So we started with our own youth, and then we had them go from there. So we provide technical assistance to help them find youth. And then, did I miss anything? Okay, I think that's it. You can go to the next slide. And that's been really successful. And that is all I have. I didn't realize that this was the last one.
What
But
day
I'm
is the
happy.
quarterly call?
I'm sorry.
What day is the quarterly call?
That is May 10th.
Perfect, thank you.
And it's been very successful, and we're really, really happy with how that's going. I'm going to put my email in the chat. If anyone wants to reach out, I'm happy to share anything we have.
There's a lot of chatter in the chat related to transition in healthcare in particular, and some advocacy. I did add a few of the resources as you were talking, like the YouTube channel and some I think a Fact Oregon website. Are there any other questions from the group that you have for Donor Christie?
I did want to mention that if you have no idea who your parent center is in your state, or you need information, you can go to parentcenterhub.org and find your parent center there.
It is a great place. Also has some really great resources
Absolutely.
for educators and other agency folks. So when you think about other agency partners, parent centers are a really valuable partner, but when you're thinking about partners that you'd like to reach out to achieve your mission, who else? You talked a little bit about VR, but who are the other community partners that that you all work with to be able to truly kind of carry out the mission of the parent centers and reach all families?
In Oregon, we have many community partnerships. We're doing some focused work on underserved populations, and we went through a very long diversity, equity, inclusion process a couple of years ago, had a stakeholder group to help us identify. And so we work with organizations like Latino Network that supports families, Hispanic and Latinx families in our state. We work with our IRCO, which is an immigrant and refugee center for families coming. We work with African Youth Coalition. So we partner with our local DD programs, developmental disability programs. We also partner with some schools and those serving folks that we want to reach, because we know that families who live in rural Oregon are as varied as they are in Portland. We're also lucky in Oregon because we just in October, one of our partners in Central Oregon became a community parent resource center. And so they serve 8 rural counties in Central and Southern Oregon in a very rural part of our state. And so we are able to connect with them and leverage those partnerships. But we engage in education justice. So statewide organizations serving that are not disability. And we're doing a lot of that work where we bring the voice of disability, but we're working with partners that's not their focus. Their focus is families and kids.
Excellent, thank you.
Yeah, so at SPAN, I am one of almost 70 employees. So, and we're statewide, obviously. And so we have many partners. Just to name a few, we partner a lot with the DD Council, Developmental Disability Council in our state, the Centers for Independent Living. We have a grant, it's under the State Department of Ed, where we work with special ed advisory groups in school districts. So we have, we have feelers out everywhere, and we partner with many. I mean, I don't have a list. There's so many of them.
The same. And I just added to the chat, someone was asking about resources for supported decision making. And the ARC Oregon has created some flyers for youth and for adults, and they're in English and Spanish. So I'm just putting some of those resources in that we have used to share with families, because they're actually really good. They've really worked hard at making them accessible and visual for youth and for families.
Yeah, I mentioned that we had that 4-part supported decision-making series, and we collaborated with Maine Parent Federation, which is the Maine Parent Center, and they're doing a lot of work around supported decision-making. I would check out their website, because I'm sure you'll find resources there, but they're doing a whole lot of work around that. And so if you check out the 4-part series on the YouTube channel, there's resources associated with that in those PowerPoint presentations as well.
I mean, it looks like
You know-
Ohio has shared some stuff too.
Yeah, and we I mentioned the workshops that we're doing. We do a lot of upfront, I call it upfront work on really building the self-advocacy skills and the student-led IEPs, because when those skills are built, then supported decision-making is the natural progression. So in both of those workshops, at the end, we say, so now that we've built these skills, this is what supported decision-making is.
Dawn, I just added the link to the main website you referenced.
Thank you. And I think the executive director is actually on.
So if I
Carrie
got
Ricardo.
the wrong
She put the
website.
link as well. Thank you.
Good. Any other questions?
I do want to mention that with the youth that we're doing in our region, we have found that because of having that youth leadership council and having them all meet each other, this is so cool, because they are collaborating and they're writing proposals together. So I do believe we have our Parent Center National Conference in the fall. And 2 young adults, one of them is the youth coordinator from Maine, and someone from Massachusetts Parent Center. They're actually, I could be wrong because they wrote for something else, but they're actually writing proposals to do supported decision-making presentations and other things. I think one of them was intersectionality. So it's wonderful to see them now start collaborating. I mentioned we have 70 employees, and one of the centers says she has 8. I know, I hear you. Well, we're very populated in the Northeast.
In Oregon, I have a total of 12 people with about a 9 FTE, so I understand.
Thank you for having us.
Yeah, it seems like questions are slowing down. You both were fabulous. Thank you so much for coming and sharing all these great resources. The chat is savable for anybody that just wants to grab that and make sure that they get a chance to hold on to all those things that were shared in the chat today. Yeah, thanks so much.
Thank you.
Thank you.
Oh, and for our attendees, I would just like to remind you that next up on the schedule, if you are on a state team, it is team planning. But if you are not, we have an exhibit hall that's got these centers across the nation with great resources. Some of them have folks available to chat if you would like to jump over there. And don't forget to do our evaluation at the end. All right, thanks so much.